paying for mistakes that are preventable, that are unnecessary, that should never have happened in the first place. And so we're hoping that this legislation gets through the Assembly, will reconcile the differences, and the governor will sign it, again, giving consumers more information, and also not rewarding bad behavior, which is really poor medical care and these never events that should never take place. And we're hopeful that we're going to change the landscape here, at least in New Jersey.
Thank you, Senator Vitale. AARP is committed to working with Senator Vitale to make sure this bill becomes law by the summer. So we encourage you, as you receive information from AARP, to take action and call your state legislators, in particular your state assembly members who are now going to be faced with having to vote on this bill. So again, thank you very much, Senator Vitale. I know, though, in trying to drive costs down on health care, we are looking on the federal level at different issues and different payment policies that might try to reward better quality care. Perhaps, Congressman Pallone, you could talk a little bit about some of the initiatives that are either already ongoing or that the Congress is considering.
Well, as part of this health care reform that I mentioned already, we're trying to look at new ways of doing things, because when you talk about costs and they continue to rise, I mean, there are a number of factors, but a big factor is just, for example, new technology that comes along that people, of course, want to be able to take advantage of. And so we have a number of ideas, and some of these may be incorporated either overall into the healthcare reform or maybe demonstration projects. One of the things that's already happened is that in the stimulus package, we put $17 billion for health information technology, a way of trying to upgrade both hospitals and doctors' offices so that they put, for example, they make their records electronic. Or that, I mean, and these are ways of trying to eliminate mistakes too. I mean, to the extent, for example, with drugs, I mean, I've been to different hospitals that have a way of checking any kind of errors that might be made with the distribution of prescription drugs. So, those types of electronic means can make a difference. The other thing is we put in the stimulus money for what we call comparative effectiveness research, which means that the federal government will start to look at different ways whether certain drugs are effective, whether certain procedures, operating procedures or whatever, are effective from a cost-benefit analysis, for example. I mean, there are a number of things. One of the issues that's gotten a lot of attention lately relates to rehospitalization. In other words, in the same way as Senator Vitale said that Medicare does not pay for medical errors anymore, should Medicare pay for someone having to be rehospitalized when they shouldn't have been sent home from the hospital in the beginning? So this is one of the things we're looking at. And I could go on, Patricia, forever, but the idea is to incorporate these either overall or in healthcare reform as a demonstration so that we can look at new ways of doing things that will reduce costs as well as improve the quality of care.
Great, thank you very much. That was Congressman Pallone, and if you're just joining us, you're on a live teletown hall with AARP and Congressman Frank Pallone and State Senator Joseph Vitale. We're talking about health care and healthcare reform. We are taking questions live, so if you have a question for either of our guests or you'd like to tell a story about an experience you've had with the healthcare profession or the healthcare industry or trying to get healthcare insurance, you can press *3 to ask a question. I think we'll go right now to Brent in Blackwood. Brent has a question on healthcare. Brent, are you live?
Yeah, hi. Good morning.
Good morning.
Thanks for having me on. This is, I guess, for both of the senators. My main concern is that what the state and the federal politicians seem to do is they seem to help out low-income people as opposed to the average person. It's great to talk about child care and many of the good things that are happening with seniors, but what about the middle average person that can't get health insurance? And by the way, State Senator Vitale was mistaken. As a licensed insurance broker, the amount of carriers in New Jersey has actually decreased substantially since '93. We only have, lucky, about a half a dozen carriers. We used to have over 100. And I'm concerned that the federal government will be much like New Jersey. And since '93, the cost of health insurance for the small business owner and the average guy has gone up 1,000%.
Well, Brad, this is Frank Pallone. If I could say a few things. First of all, I mean, as you know, whenever we operate in a capitalist system, and presumably, people take care of their own benefits rather than relying on the government. And I get criticized every day for, government programs, and people say, well, why are you doing this? Why are you doing that? People, should take their own responsibility. I mean, if it were up to me, I would have, the government put together a program that covers everyone, and that's what we're trying to do now with the health care reform I mentioned. But we're building on the existing system. We're not just going to go to a single payer system or, like what they have in Canada or Britain, where the government controls everything. We're trying to say, look, if you can get health insurance now through your employer, which is the way most people continue to get it, then we won't interfere. But we know that the numbers of employers who provide health insurance has gone down. I mean, in other words, it used to be like something like 76% of Americans got their health insurance through their employer. Now that figure is only about 61%. So what you're seeing is, as the costs go up, and you mentioned the costs keep going up, there's the notion that the government should do more and not just have people rely on their employer or go out and buy individual insurance on their own. So that's the response is what I discussed before. I forget who I was talking to. Maybe you were on the line. But basically, what I said is that we're drafting a bill now, and this is the Obama health care reform plan, that says that if you're not eligible for Medicaid because you're not poor enough, or you're not over 65 in Medicare, you're not getting health insurance through your employer, you'll be able to get it through the federal government, and the government will ask the private insurance companies to provide a plan. In other words, a reasonable plan that has good benefits and that has lower costs, and then you can go to the federal government through this health marketplace and choose one of these plans. And because now all the people who are now in the individual market and most of the people that are in small group plans will be folded into this, we figure there might be 50 or 60 million Americans that would be taking advantage of this, and that would bring the cost down. And if you still can't afford it, we will subsidize the premiums. So everyone will have health insurance, and it won't matter what your income is. You pay the full freight if you can afford it. If not, you get you get subsidized. But again, this is only for those people that don't get health insurance through an existing government program now, or don't get it through their employer.
Hi, Brent, it's Joe Vitale, and I just, two things. One, I wanted to clarify my earlier statement. I was referring exclusively to those insurance companies that offer liability coverage for physicians, so it's malpractice insurance. And Mix was the big company in New Jersey that, for a number of years, was the one who almost exclusively provided coverage. And so there are a few smaller ones now, there are startups that are providing coverage for more docs. So I was talking about exclusively the malpractice issue, but I wanted to expand on what Congressman was talking about in terms of coverage for really middle-income Americans and New Jerseyans. We have, that's our frustration as well. We're covering low-income children, some low-income parents. At the higher end of the economic scale, of course, people can afford their own, where seniors are in Medicare and poor folks are in Medicaid. What about the middle? My frustration, of course, has been with the middle class and employer-sponsored coverage. It's my belief, and I know the Congressman shares this, that everyone should have access to health care and affordable health insurance. And if it's driven by employer coverage almost exclusively, and we get to a bad economy like we are today, then the employers cut coverage or eliminate jobs, which eliminates your coverage. And so it's really your coverage and the dependability and reliability of the coverage is really dependent upon, almost sometimes the economic climate. And your care shouldn't be dependent upon those things. And so having this government-sponsored, government-run, some fashion program gives the average American who doesn't have health insurance the opportunity to get it at a price that they can afford. And I think that's really the best of all worlds. If the employer wants to continue to cover it, that's a good thing. But provided that's a good thing. But there are many small employers, and the majority of those who are uninsured work for small businesses.